Hello and welcome. Thanks for joining us today for Getting Started with the Telemedicine webinar, and this is presented by Rubbermaid Telemedicine. My name is Paula Guy, and I'll be leading the presentation today. I want to take a second to give you a bit more information about my qualifications and myself. I have 12 years of leadership experience in building telemedicine networks here in the state of Georgia, and I'm currently serving as the CEO for the Georgia Partnership for Telehealth. I've also served on advisory boards for the Georgia Technology Authority. I'm serving on advisory committees at the federal level, and I'm also serving on the Georgia Health Information Exchange Board. Before we dive in together, I want to broadly determine the definition of telemedicine and what we will be discussing more about today. This is the official definition of telemedicine as defined by the American Telemedicine Association, or ATA as we know it. Telemedicine is the use of medical information exchanged from one site to another through electronic communications. The transmission of still images is commonly referred to as storing forward. Another major method for telemedicine is remote monitoring, which can be any sort of monitoring of the heart, blood pressure, or vital signs from afar. And again, the third form of telemedicine is live consultation, and this is what we will be touching on today. As I said, primarily we at GPT participate with telemedicine through teleconsultations, which is typically video conferencing and sharing live content that is encrypted with live feeds from doctor to doctor or doctor to patient or both. In this slide, you can see that Rubbermaid telemedicine carts are ones that we use for the live option. It allows for televisits and consults. From the diagram, you can see that the patient is able to access their primary care physician, a second physician, and a specialist to discuss any health issues in real time and actually see live images. It's pretty incredible. As you can see on this slide, live telemedicine can come in many forms. Here you can see the Rubbermaid telemedicine card on the right, as well as TVs, computers, and tablets with video capabilities. One type of telemedicine is remote monitoring. And with remote monitoring, the patient has a central system that feeds information from sensors and monitoring equipment to an external monitoring center. This could be done in either real time or the data could be stored and then forwarded. This type of telemedicine is instrumental in treating patients on dialysis who are managing chronic disease like COPD, congestive heart failure, diabetes, arthritis, depression, and currently so much emphasis on obesity. Store and forward encounters are another useful type of telemedicine. And in store and forward, telemedicine like digital images, radiology, video, audio, observations of daily living, clinical data are captured and stored on a client computer or a mobile device. Then at a convenient time, they are transmitted securely or forwarded to a clinic at another location where relevant specialists or even primary care can study them. The opinion of specialists is then transmitted back to the primary care physician, which we believe that primary care physicians are excited about this because they stay in control of the patient and they have the information right then. With live video encounter, a telecommunication link allows instantaneous interaction. Video conferencing equipment is one of the most common forms of synchronous telemedicine. Peripheral devices, such as this patient exam camera, can also be attached to computers or the video conferencing equipment. Also, things such as Bluetooth peripherals can also be attached to this cart for easy access for physicians and nurses who are examining the patients. With the availability of better and more cost-effective communication channels, direct two-way audio and video streaming between centers through computers is leading to lower cost. Live encounters are useful to telecardiology, teleneurology, teleradiology, and telehealth for connecting psychiatrists with mental health patients. Now, I'd like to talk a little about why telemedicine is getting so popular. Doctors and patients all over the nation are seeing real value in telemedicine, which has resulted in major growth for the industry. In 2010, the global telemedicine market was estimated at $9.7 billion. In just 4 years, the industry is expecting substantial growth. The 2014 global telemedicine market is estimated to be at $19.5 billion. One of the major factors in this growth is the combined increase in life expectancy with a physician shortage. The graph shows this increase in life expectancy from 1950 to the estimated expectancy in 2050. You can see that it is steadily increasing. With that being said, our future demand on physicians will outweigh our supply. By 2050, we will be experiencing a shortage of both physicians and nurses. As technology has increased, so has the price of health care. Providers are exploring alternative methods to make treatment more affordable, of which telemedicine is one, and a key one. The graph on the left shows the increase of MRIs given to the population. You can see a major increase from just 1993 to 2007 as this technology becomes more widely available. The graph on the right shows the price of a day at the hospital and how it has risen tenfold over the past 40 years. This slide also shows the increase in healthcare cost. From 1990 to estimates for 2016, U.S. healthcare costs will increase from $1 trillion to $4.1 trillion. The average healthcare cost per person is expected to increase from an average of $2,000 per year to over $12,000 during this same period. The graph shows the overall use of telemedicine across hospitals in the U.S., giving us an indication of just how prevalent telemedicine is. There are so many uses that even those that are using telemedicine currently might not be aware of them all. Some of the most recognized uses are called out in red, such as ultrasound, neurology, stroke and heart attack, emergency and trauma care, and finally, critical and intensive care. One of the major drivers of telemedicine today is the fact that patients are demanding more control and improved access. This means telemedicine has a place in healthcare from large academic medical centers to the home, to everywhere in between. With telemedicine technology, hospitals are able to discharge patients earlier and eliminate readmissions since they can be monitored from their homes or at other local practices. There has been utilization of telemedicine in small rural medical centers since they have limited specialty care. Using telemedicine allows them to connect patients with specialists outside of their area. Physicians are incorporating telemedicine into their practice, offering collaborative care. It is a great way for them to expand their business and generate more revenue as well. Existing clinics can provide improved specialty care by using telemedicine. They can also offer their services to prisons and provide urgent care to consumers. New clinics are developing around the use of telemedicine technology. We're seeing tons of growth in school-based health clinics and workplace clinics. Retail pharmacies are sprouting up, like at Walmart, offering care to customers as well as at airports and for those needing medical care while traveling. We discussed some of the most common uses of telemedicine in an earlier slide, but I want to share real-life examples of how programs have been implemented and how they are helping both doctors and patients. Cincinnati Children's Hospital Medical Center is providing mobile telemedicine care to patients in ambulances, connecting them with physicians at the hospital. When seconds count, EMTs can administer treatment or medications based on the doctor's recommendations. For high-risk pregnancies, women who live in rural areas are able to access medical specialists without having to risk extended travel. Telemedicine allows for the specialist far away to view ultrasounds to help make decisions about medical care. In the past, essential minutes were lost through lack of diagnosis of stroke. With life-saving drugs available, which work best when administered quickly, neurologists are using telemedicine to rapidly and accurately diagnose stroke victims who live hours away from their specialized care. Telemedicine for those in critical care, known as tele-ICU, it allows doctors to monitor patients under their care while they are not in the ICU. It is so effective that the University of Massachusetts Medical School did a study and found out that using telemedicine in ICUs also drastically reduced both mortality rates and length of hospital stays. Now that we know more about the background of telemedicine, I want to discuss the practical application of it in your practice. Specifically for the GPT network, scheduling is very important for routine appointments. Scheduling is accessed via the internet by logging in with a username and password. There are important parts to the IT infrastructure that need to be in place to make telemedicine usable and successful. First, you must have a secure internet connection. Specifically, this means the network must be HIPAA compliant, meaning it's encrypted and secure so it won't compromise personal patient data. Sufficient bandwidth is important to prevent freezing or lagging. When seconds count, an uninterrupted feed is critical. In Georgia, our network, most of our sites are eligible for universal service funding, and you can find out about this through the FCC's website, www.usac.gov. IP video conferencing standard is also very important. It's very easy to make calls. Physicians love it, and our providers and presenters at these locations love it as well. Multi-point video conferencing allows you to speak with more than one person at a time. Literally, a physician can consult with another physician and the patient at the same time, and it's also used for continuing education. Next, we want to discuss access models. When building your network, you will need an idea of what type of access you are looking for. This will be specific to your practice and your needs. This is a diagram of an open access model, and that's what we currently have with GPT. An open access model allows you to create a web of access points. Any presentation site has the ability to connect to any other site. To give you a better idea about the GPT network, we have over 500 rural and specialty sites within the network. There are also over 175 specialists representing 40 specialties in the network. Our encounters between doctors and patients using telemedicine has increased greatly. In January of 2006, we had 8 encounters total. In 2011, we were averaging over 3,300 encounters a month. The graph shows you the increase of encounters over several years. When fully realized, we expect that every single Georgian will have access to health care within short distances of their home. The payer mix for GPT Network varies. As you can see, the largest payer is Medicare at 45%, with commercial, Medicaid, and other payers coming in each between 17 and 20%. To give you an idea of the cost savings the GPT network creates, 160 nursing home visits to the ER were avoided, saving $480,000. In a small pilot project, school-based health clinics saw similar savings, with 118 ER visits avoided and $354,000 saved. And then for the patient, a random sample of 40,000 telemedicine encounters showed an average travel distance of 124 miles to receive care without the GPT network. Well, just in fuel alone, the network saved $762,000, and this did not include lost wages, meals, and other travel expenses for long-distance medical care. This graph shows the increase in utilization of the GPT network from 2006 to 2011. As you can see, overall there's been an increase in usage ranging from 0 encounters to a little over 4,000. As our encounters have grown, logically the presenting sites where patients can go to interact with a physician through telemedicine have grown. In 2006, we had around 22 presenting sites, and now we have over 300. And to handle the increase in presenting sites and patients, the network physicians has also seen an increase. The growth from 10 physicians in 2006 to 204 in 2011 shows just how useful telemedicine is to the medical professional, not just the patient. In this graph, you can see how the presenting sites and network physicians has grown in tandem with the GPT network. Summarized on this slide are our top 10 medical encounters to give you a better idea of what the network is being used for. We have found that wound care and psychiatry are our biggest uses at this time. As the use of telemedicine grows and its usefulness is adapted into new practices, I envision this list changing as well. There are several key areas we are focusing on with this growth. First would be the development and implementation of a telestroke program across the state. Also, GPT has benefited from 4 USDA grants, which has helped us expand telemedicine here in Georgia. And because of the way we've applied telemedicine, we were awarded the Southeastern Telehealth Resource Center, which I'll share more about on the next slide. We've benefited from a Broadband Technology Opportunities Program, which funded quite a few of these carts to be implemented out in the field. Also important is the expansion of the nursing home program. so we can provide services to the elderly, prevent unnecessary ER visits, patients who need care and have mobility and health issues. This is absolutely the easiest way to provide those services. Finally, we're also working on public school telehealth pilot projects where students can receive medical care in their school clinics if they don't have access to doctors in their areas. In August of 2010, Georgia Partnership for Telehealth was awarded a grant from the Office for Advancement of Telehealth to become the Southeastern Telehealth Resource Center. The goal is to offer technical assistance and advanced telemedicine in Southeast, including Georgia, Florida, Alabama, and South Carolina. Recently, there has been much legislation that has helped further the growth of telemedicine. The Georgia General Assembly passed House Bill 291 in 2005 that required every health benefit policy to reimburse for telemedicine. The Centers for Medicare and Medicaid Services issued a policy in May of 2011 which streamlines reimbursement services and the credentialing processes. Our sponsor for today's webinar is Rubbermaid Healthcare, who offers one of the most utilized and easy-to-use telemedicine carts available. GPT has utilized this in a big way and have found that Rubbermaid provides an efficient, very organized level of support to these carts and have provided an invaluable service to GPT. Because it is a cart, it works as a mobile solution that can go where it is needed. It is incredibly versatile, offering many functions you can't get just from video conferencing. Standard features of the cart are high-definition video and PC-enabled functionality. It also has a 22-inch screen with a multi-touch functionality with a webcam and integrated audio. The battery will actually last 2.5 hours. Rubbermaid also has a unique power lift system that makes it easily adaptable for standing or sitting, and if you're tall like me, this is important. Also, optional features include whiteboard annotation technology, wireless internet, and medical-grade keyboard and mouse. Thanks once again for today's participation in the webinar. Rubbermaid is working on a series of informational webinars on telemedicine. If you're interested in learning more about them when they become available, email webinars@rubbermaidtelemedicine.com. Finally, the information for Rubbermaid Telemedicine cart sales is 1-888-859-8294 if you are interested in learning more about the platform. I hope this presentation has helped you learn more about telemedicine and think of ways to incorporate it into your own work. As always, GPT is here as a resource for you. Please feel free to contact us if we can help you further. Have a great day.